The first 3 minutes, Crisis Resource Management in Team Training. Discussion by Dr. Nola Regan, Assistant Professor in Department of Anesthesia at Memorial University of Newfoundland. The first 3 minutes refers to the first 3 minutes of a crisis situation. These crisis situations have been trained by using ACLS and ATLS algorithms for the management of these medical crises. It does not provide team management skills for dealing with the crisis. This primarily is dealing with communication and management skills. The first 3 minutes is the discussion of team organization, how to initially get your diagnosis, and management strategies at the onset of any crisis situation. Dr. David Gava is a anesthesiologist at Stanford University. He developed a curriculum to teach his residents the management and communication skills required while dealing with crisis resource issues. This included the establishing of team roles and responsibilities. As well, he developed the idea of crisis resource management, which is essentially a shared mental model for a team approach to any medical crisis. The SBAR, or SBAR, is a common method for quickly assessing a critical situation. This typically or has been traditionally used in the nursing nomenclature, but it's quite useful for us as well. S stands for situation. What is the situation surrounding the crisis? B, background. This would be similar to past medical history, but more to the point. What is the essential medical history with this situation? A is assessment. What is the current assessment of the situation? Again, fairly quick and brief. R, response. What response has been taken so far to deal with the situation? This SBAR is typically also used for either doing handover at critical scenarios or for catching somebody up to speed who's newly arrived on the scene. A classic resource management team has various different team members. There's the team leader, somebody on airway with an airway assist, a medical doctor, which could be pretty much anybody, whether it be internal medicine, surgery, whatever, a floor nurse, an ICU nurse, and somebody else on chest compressions. These would be the main members of any crisis resource team. The team leader at our institution is typically a medical resident or the senior physician at the situation. Their responsibility would be to identify themselves and their position, so their name and senior medical resident, what have you. These individuals are responsible for the situation assessment, organization of the team, directing treatment, and triaging priorities, what needs to be dealt with now and in the near future. The team leader's situational assessment would include receiving an SBAR, typically from a floor nurse or from somebody more junior who is handing over. He also needs to get the A, B, C's, and D's, which would be airway, is it patent? Breathing, i.e. the respiratory rate and quality, is the patient hypoxemic? Circulation, which would include the vitals, heart rate, blood pressure, plus the cardiac rhythm. Disability is typically covered by AVPU. Is the patient alert? Are they responsive to vocal stimulation, painful stimulation, or are they just unresponsive? The team leader also has multiple responsibilities with communication. First would be closing the loop. That would be repeating things that have been said to him for the benefit of the entire group, so everybody is on the same page or sharing the same mental model. Sometimes this would include an abbreviated summary, again, so the entire team knows what's going on. Any new information that is brought to the team leader should be repeated for the benefit of the team, again, for situational awareness. Now, the team organization are typically reliant on pre-assigned roles, but it should be a dynamic situation in which these roles may be shifted. Aside from the team leader, everybody should attempt to be a good follower, i.e. do the jobs that we're responsible for. Airway is typically covered by anesthesia, the airway assist by a respiratory tech, medical doctor, again, any other physician that's available They tend to need to have skills for doing procedures, and compressions essentially can be anyone, a nurse, an anesthesia resident, or the cleaner that happened to be in the hall. Now, the airway. Again, you need to identify yourselves. I am a senior anesthesia resident, and I am on airway. You are responsible for assessing is the airway patent? What is the respiratory rate, the respiratory quality? Is there any hypoxemia? As well as the quick assessment of disability, which would be the AVPU assessment. Airway assist. Again, they need to identify themselves and their position. I am Janie RT and I'm at Airway Assist. They are responsible for ensuring that the airway equipment is available for managing the airway. So checking into tracheal tubes, cuffs, stylets, etc. They also need to assure that there's a good oxygen source, suctions available. They assist with the airway management when it is occurring, and they are a secondary or confirmation of the respiratory exam, i.e. respiratory rate, respiratory effort, SaO2, etc. The medical doctor can be anyone or any physician. Again, identify themselves. I am a senior surgical resident, and I'm going to be medical assist. These gentlemen or gentle ladies are responsible for assessing pulses, rhythms, and doing various procedures such as IVs, arterial blood gases, etc. These individuals also act as a mental resource. So again, this allows for duplication of the vital signs, as well as being an assist to the person who's actually running the code, i.e. for differential diagnosis and such. The floor nurse, again at the code, should identify themselves and their position, what they're going to be doing. Typically, they're responsible for providing the SBAR because they would be the ones who called the code. They should know what's going on. They also take the blood pressure at bedside, take pulse, are responsible for giving defibrillation and for giving medications. ICU nurse, again, should identify themselves at the onset of a code and what their position is. They are responsible for preparing the medications that the floor nurse would give, recording resuscitation events such as defibrillations or medications giving. They're also useful in assessing and monitoring the rhythms that they should be familiar with from the ICU situation. Again, this provides duplication of services or resources that the medical doctor and the team leader should also be assessing rhythms. Chest compressions, again, should identify themselves and their position. Their only responsibility is chest compressions. Chest compressions is physically laborious, and this position should be reassessed frequently as somebody may tire from doing them. Now, the simulation itself, it's an artificial environment. Nobody is actually going to die today. These situations or simulations are going to represent essentially the first 3 minutes of a code situation. These are designed to practice team skills and communication. They are going to stop regardless. Most of these will not be allowed to carry it out to a logical ending. Now, you will be asked to play a role of a position you may be unfamiliar with, such as a nurse. Please stay in the role for the simulation. It is very important that people become familiar and appreciate with the roles that other people have. And finally, in review, please familiarize yourself with all the roles that we've just discussed. Know who is responsible for what. It is important to know what all members of your team are responsible for. If they are not familiar with the situations or their responsibilities, as a team leader or somebody on airway, you can help direct them to what they should be doing. Keep in mind communication. It is important to vocalize any change in situations or new findings. As well, your team leader should be able to independently get a set of vital signs and disabilities from the team members through communication. Remember, close your loop. Acknowledge things that have been said to you and assure that things that you feel are important going to the team leader is acknowledged. And if you are a team leader, again, remember to close the loop. Hope to see you all on October 22nd.